Barriers to mental health care in non-psychiatric settings. Hello, my name is Lauren Carnes. I'm a registered nurse, and I'd like to give you a little background about myself. I have 15 plus years experience working as a community-based mental health nurse. For the last 10 years, I have been running, and I also co-own a Medicare, Medicaid-based home care agency that services the mental health population within our communities. I participate on state mental health and drug court teams, and I have built relationships with DMH, DPH, and other mental health-based agencies. The topic of this research is to assess mental health training and non-certified community nurses and its impact it has on patient outcomes. Mental health impacts 1 in 5 Americans. Persons with mental health disorders are at risk for developing physical illness due to suppression of immune function, poor health behaviors, treatment adherence, and stigma, causing barriers to obtaining treatment. The National Alliance on Mental Illness reports that untreated mental health will cost about $300 billion a year in untreated mental illness related to lost productivity and accrued costs related to inadequate treated mental health. We also have lack of political support, inadequate management, and misunderstandings about mental health disorders and their treatment further complicates the development of our effective mental health systems. A review of current literature identified the following themes: lack of mental health literacy, lack of training, and stigma related to mental health. The purpose of this study is to identify positive health outcomes of adequate mental health training in community nursing. The research will highlight barriers or strengths of current training and guide further research for universal mental health training. During this research, we'll implement mental health nursing certification requirements by exam through the American Nurses Credentialing Center during all orientation processes to provide nurses with further education to give quality care to patients diagnosed with mental health disorders. The nurses will complete an intervention survey prior to educational training and post-training. The intervention survey intends to determine information retained, new skills, quality care improvement, and impact on their experience while caring for patients with a mental health diagnosis. This evidence-based research will identify positive health outcomes of adequate mental health training in community nursing. I'd like to discuss the gaps in literature. Through a review of available literature, very few studies were conducted in the United States that identified non-psychiatric nurses' barriers in caring for patients with mental illness. There is lack of research on the views of non-psychiatric providers and barriers they feel are present in treating this patient population. This is important when identifying provider-specific biases to implement education to reduce stigma. Further research should be conducted to assess ways in which communication and segregation of the patient can be minimized to promote patient outcomes. Important points raised in the literature also addresses and concerns and benefits of collaborative care when addressing patients with multiple comorbidities, including psychiatric diagnoses. It is necessary to conduct further research to examine if increasing education alone is enough to contribute to decreasing stigma And lastly, further research should address interventions to safely treat mental health while addressing medication side effects, as providers do in patients who do not suffer from psychiatric diagnosis. The research method used is the quasi-experimental study design. This was to identify positive health outcomes related to adequate mental health training for community-based nurses. This research project aims to raise mental health awareness, increase knowledge, improve care, and provide quality interventions for an overwhelmed mental health system. The participants are the employee registered nurses and not all newly employed nurses from the home care organization. The research design, the nurses will be invited to participate in further education by obtaining psychiatric mental health nursing certification from the American Nurses Credentialing Center. Also, we'll be using the Jefferson Scale for health professionals. This measures empathy in physicians and other health professionals involved in patient care within a clinical setting. The second survey that will be distributed is the attribution questionnaire. This scale is used to measure public stigma towards mental illness among healthcare workers and the effectiveness of anti-stigma programs. We'll be using web-based questionnaires that will be distributed to the nurses pre-certification and 6 months post-certification. An optional follow-up survey will be distributed once a year. The feedback that's collected by nurses will be used to evaluate and adapt to the implementation process to improve the reliability of the project within the home care setting. Based on these findings, recommendations will be provided to the Massachusetts Association for Mental Health regarding the barriers to understanding how to care for patients with mental illness in a non-psychiatric healthcare setting. It will also address how increased mental health training impacts the care of this patient population. Significance to the field of nursing. Outcomes will show that nurses who have received specialized education will increase compassion, understanding, and empathy when caring for patients with mental health disorders. Nurses will have a better understanding of therapeutic intervention and how to care for acute changes in mental health status. Nurses will identify the barriers to adequate care provided to patients with mental illness. Adequately trained healthcare workers at specialized community and primary healthcare levels will improve quality of mental health care. Innovation. In alignment with the evidence-based Iowa model, the identified problem being examined is poor patient outcomes in non-mental health settings and lack of training. Conceptually, this project shows the benefit of increasing nursing's understanding of mental health literacy, providing therapeutic intervention, identifying mental health crisis, and improving quality of life. Post-training, nurses will be able to identify the barriers to adequate care provided to patients with mental illness. By raising awareness about mental health disorders through education and advocacy will reduce stigmatizing behaviors by healthcare providers. This project will foster effective strategies to address patients with mental health disorders. Positive improvement in mental health literacy to improve future mental health post-care delivery. Therapeutic intervention could potentially decrease hospitalization and acute ER visits, which in turn will save the state a lot of money. Improve health and quality of life for patients affected by mental health disorders. Reduce stigma amongst healthcare professionals. Provide support for mental health training across a wider variety of healthcare providers and professionals, and identify the barriers to adequate care provided to patients with mental illness. Thank you.